Hi, I'm Jen with Pensacola Mom Collective, and I am here with Dr. William Schwartz, who is a maternal fetal medicine physician with Ascension Sacred Heart's perinatal uh, facility here in Pensacola. Thank you, Dr. Schwartz, for being with us. We really appreciate it.
You're welcome.
So, talk to us about the term maternal fetal medicine. That's not a common term that we hear. What is your role, and how is that different from an OB?
Excellent question. We are an obstetrician. We're double boarded. I'm an obstetrician gynecologist, and I did my medical school, then 4 years of OBGYN residency. And then after that, you decide to specialize into where you could do higher levels of care for maternal women and their baby, fetal, and also maternal fetal medicine. So it just is more in-depth studying on how to take care of the mom with a variety of complications. It could be with medical complications or with complications from labor, or if they're having problems with the baby. So
Okay.
we are trained for 3 more years than an obstetrician to do all this.
Okay, great. And so, what are some of those common reasons that a mom might be referred to your care?
Kind of break it down into maternal complications. If a mom has pre-existing diabetes, chronic hypertension, hyper or hypothyroidism, seizure disorder, if they have pre-existing cardiac disease or obesity, those are some of the few reasons that we see women with maternal complications. Previous obstetrical complications would be preeclampsia, which the old term is like toxemia in pregnancy, which means high blood pressure in the woman's spilling protein. If they had a preterm delivery, if they have what's called cervical insufficiency, you probably hear it more in layman's terms, incompetent cervix. It means the cervix was weak and they lost the baby in the second trimester. We would put a stitch in that to help them keep their next baby. If there was abruption of the placenta where the placenta released from the uterus early, we would watch them closely to make sure that didn't happen again, or if they had a history of a stillbirth. Those are some of the obstetrical complication reasons. Fetal complications would be like if the baby's growing small, or the patient's lucky enough to have multiple gestations, like twin or triplets, hopefully not quadruplets, or like if you were concerned for a possible birth defect.
Gotcha. And is age an automatic reason why someone would be referred to you if they were over the age of 35 when they're pregnant?
Good question. A lot of obstetricians can handle the age, but they need to be counseled appropriately. There are some increased problems, particularly a slight increased risk of chromosome problems as the woman is over 35, but there's always that risk. It just increases a little more. And it is recommended by our society guidelines that a high resolution detailed ultrasound is done at the baby in the second trimester at about 18 to 20 weeks to take a good look at the baby to make sure the baby looks fine.
Wonderful. That's great. And are there any other reasons a mom might be referred to you for an ultrasound other than that, and that the high resolution?
There's basically 5 categories. If the baby, previous child had a congenital or genetic or chromosomal problem, if the obstetrician is concerned for a birth defect or a growth abnormality, if the baby is at increased risk for an anomaly because the mom has gestational diabetes diagnosed before 24 weeks on insulin, or pre-existing diabetes, or if the mom had in vitro fertilization, there's a slight increased risk of birth anomalies, particularly heart defects, not a lot, but a slight. If their body mass index was greater than 35, or multiple gestations, particularly identical twins, they have a slight increased risk of birth defects over fraternal twins. And then 4th reason would be if you thought the fetus was at risk for a genetic or a chromosomal abnormality, like the mom gets a test to see if the baby has Downs. If the test came out positive or chromosomal, we would take a look with the ultrasound, and if we thought there was a problem, might have to do an amniocentesis. Some of the rare reasons would be if you thought the mom had a congenital infection like cytomegalovirus, thought the baby might be anemic, the baby's peeing too much or too little, or if the mom was dependent on a drug medication, like having problems with that, we would see them for that.
Gotcha. And so just because someone is sent to you for care, to put everyone's minds at ease, does not necessarily mean there's a problem. Sometimes it's like it's really truly for screening to confirm everything is okay. And treatment would proceed from there if there were a problem.
Fortunately, most of my visits are reassurance. So I'm able to go to them. I know you're concerned about this, but everything seems fine. Every once in a while, there is a problem, but most of the time, it's a reassuring visit.
That's great. Well, reassurance is really important, I think, for anyone who is pregnant and expecting a baby or babies. I know it's a nervous time, and I think anxiety can be kind of prevalent throughout the 40 weeks of pregnancy. And so I know reassurance is incredibly important. So tell us a little bit about the hospital at Ascension Sacred Heart. You have both what is called a perinatal specialty unit and a neonatal intensive care unit. Talk to us about both of those and what makes those so special here here at Sacred Heart in Pensacola.
Yeah, they're both excellent units. I mean, it's one of the reasons I came here. It is really well done. If from another hospital, if they're not able to handle because of the gestational age, they might need to be delivered because of preterm labor or preeclampsia. They're transferred to our hospital, or if their OBs are already here and they go to the perinatal specialty unit, we have highly trained nurses specialized in taking care of moms and babies that have the high risk problems that we've been describing. There's always a maternal fetal medicine specialist from our team rounding on the patients every day. We have 3 highly trained nurse practitioners in our system that also, they round with us and they round on the patients to give them lots of information. And so it's a very good center. The other nice thing is there's always an obstetrician in-house 24/7 in the OB emergency room area that people are evaluated in, just in case something happens. And there's also a University of Florida OB/GYN attending also present. And this is also an academic teaching, so it's an excellent place to be if you have to be. The neonatal unit is excellent. I mean, they're starting to go down to, and hopefully this doesn't happen, but being able to resuscitate babies as early as 22 weeks. They have a program like that right now that started. And we work very closely with them. The maternal fetal medicine specialist and OBs work very closely with the neonatal unit. We also, every week, we have a specialized multidisciplinary meeting where we talk about the patients that are in the hospital that need care, between the OBs, the neonatologists, the pediatric specialists like pediatric cardiologists or surgeons, and a maternal fetal medicine. So it's an excellent unit.
It really does sound like a very capable and professional cross-functional practice and team to care for moms. And hopefully, like you said, there are no complications, but God forbid, yes, you know, you can deliver. We interviewed Amber Price, who's one of the midwives
Yes.
at the hospital. And what I love about that is the option for moms to have a low intervention birth if they choose. But should they need a neonatal unit immediately following, everything is right there in-house and nobody has to get transferred to another hospital. You're
Right.
not separated from your baby. So it really just, I think, gives moms the peace of mind and kind of the best of both worlds, knowing that all those capabilities are right there under one facility.
Right. And one of the patients are very loyal to their midwife. So it's funny when every once in a while they have to refer to us just for reassurance, like a little something comes up. The patients want to make sure that they're going to go back. And we don't take the patient if they don't need to. We make sure they go back, and they're all real concerned about that.
That's great. Well, if we can wrap it up, I know you have been doing this for a while, and you've seen a lot in your career in maternal fetal medicine. What advice would you give to our new and expecting moms right now?
When you're deciding to become pregnant, it's important, to take care of yourself, to make sure your health is tip top as it can be. that you're on prenatal vitamins with at least 0.8 milligrams of folic acid before to reduce some birth defects. If you have any medical problems, to make sure you've seen your physicians before to make sure they're okay. The main thing, enjoy the pregnancy and all. Some people get real wrapped up, it's a very special time and all.
Right. Yeah. I remember mine, and I was fortunate enough to have pretty uneventful pregnancies. And it really was a special time. I was a little bit more tired the second time than I was the first time, but it was really special. And it's a wonderful time of anticipation and excitement, and having wonderful physicians in our community to care for our moms during this really special time makes us a very blessed community. So we thank you and everyone at Sacred Heart for all you do for our community of moms here in Pensacola.
Thank you. Thank you for inviting me on.
Thank you so much, Doctor. We appreciate you being here.
Okay.